we need to learn the landmarks of the body. To help us with this, the human body is filled with landmarks that give us clues to the gesture and points from which to measure the proportions. These points are bony areas that show at the surface. Bones are good landmarks because they don't change much between different body types. As I point out the landmarks, try to identify them on your own body. Or if you're watching this with a friend, touch the bony landmarks on your friend's body. Awkward. Centerline of the front. At the top, we start with the pit of the neck between the clavicles. You'll see a little indentation right above the manubrium. Work our way down to the bottom of the sternum, which combined with the manubrium looks like a necktie. Below that is the belly button, and finally, the pubic bone. Centerline of the back. In the back, identifying the centerline is much simpler. The length of the spine gives you the shape of the centerline, from the top of the neck down to the tailbone. Lateral landmarks of the front. Next, I can use the landmarks across the body to identify the twisting and curving of the torso. Reaching from the back are the bony protrusions of the acromion process, which tells you the angle of the shoulders. You can feel the bony area on your shoulder between the deltoid and trapezius. Connecting the points of the acromion are the clavicles, shaped like bicycle handlebars. If someone raises one shoulder, the clavicle will rotate from the pit of the neck, changing the angle of the shoulders while keeping the same angle of the rib cage. The front corners of the iliac crest tell you the angle of the pelvis. These points are called the anterior superior iliac spine, or ASIS for short. Lateral landmarks of the back. The back of the body also has some landmarks we can use to find the angles, although some can be trickier to find on softer or overweight body types. An average or muscular back has a lot of bumps and is always a challenge for artists. To create order out of all that chaos, the bony landmarks of the scapula are very helpful. First, the spine of the scapula is this diagonal ridge from the acromion process to this corner called the triangular expansion. Like the clavicles in the front, these also resemble handlebars. From the corner, the ridge takes a sharp turn downward along the medial edge. These edges are not covered by muscles, so you'll see hints of them on the surface. The seventh cervical vertebra is another commonly used landmark. The limbs. In the arms and legs, the landmarks are basically the joints. On the sides of the elbow are the epicondyles of the humerus. When the arm is extended, these 3 points are aligned in a straight line. When the elbow is bent, the olecranon, a fancy word for tip of the elbow, moves down and forms a triangle. Follow the ulna down the arm to the wrist. At the wrist, the radius and ulna create a flat top and bottom plane that are great for showing the rotation of the wrist. The knee is very complex. I remember that there are 7 bumps. 2 for the condyles of the femur and 2 more for the condyles of the tibia. A little one on the side at the head of the fibula, 1 bump for the patella, and another below it caused by the combination of the tibia, a ligament, and a fat pad. When the knee bends, the tendon will pull the kneecap down and under the femur. The curve of the tibia is very prominent and an important part of the gesture of the leg. At the ankle, the tibia and fibula form a wrench shape that hugs the foot. The angle between them goes downward towards the outside. And finally, the great trochanter, a bony protrusion on the side of the hip. All the muscles of the gluteus wrap around it like a donut.